Amiodarone is one of the questions which is asked very frequently in the MRCP Part 1 and Part 2 theory exams, directly or indirect form as part of the MCQs to be ruled out in the options. So expect 2 to 3 questions on amiodarone in thyroid or in cardiology or as part of ACLS. So this makes it equally important, but it is a very neglected chapter. So here are all the important points which are required for the examinations. So this is basically a class 3 antiarrhythmic drug, and it is a potassium channel blocker which inhibits the repolarization in the cardiac tissue action potential. So after inhibiting repolarization, it will increase the action potential duration. Second, it also blocks sodium channels, and thus it has got properties of class 1 antiarrhythmic drugs as well. So that is why most probably it will be contraindicated in heart failures. Let's see. Now, despite being a good drug, it has got a limited usage. There are specific points why it is very less used in the medicine. So it has got a long T half, 20 to 100 days. That is why it requires frequent loading doses. Second, it requires a central vein access, which is very rarely done. So because it causes thrombophlebitis. Third, despite being an antiarrhythmic drug, it is proarrhythmic. Why? Because it increases the QT. So it will cause long QT syndrome. Drug interactions with P450 enzyme inhibitors as well. It's a P450 enzyme inhibitor. Therefore, it decreases the metabolism of warfarin. Second, it will precipitation of digoxin toxicity as well. Okay? Fourth or fifth, it is avoided in breast. It is to be avoided in breastfeeding, and it's a teratogenic drug. It is known to cause neonatal goiters. It also requires monitoring. One needs to monitor the thyroid function test, liver function test, and urine and electrolyte, and chest X-ray prior the treatment. Then thyroid function test and liver function test after 6 months. Uses, it is used for atrial, nodal and ventricular tachyarrhythmias. It is also used in the form of intravenous drugs, obviously 150 milligram after 5th shock in case of ventricular fibrillation or ventricular tachycardia causing cardiac arrest when the chest compressions are restarted. And after 3rd shock, you require IV 300 milligram. After 3rd shock, it is given along with adrenaline. In atrial fibrillation, if the history is less than 48 hours with or without structural disease, you can use amiodarone. If it is without structural disease, you can even use flecainide in such situation. Again, in atrial fibrillation, if it is more than 48 hours and the patient has got a history of recurrent atrial fibrillation or has got a high risk of cardioversion failure, then prior to this, you need to give 4 weeks of amiodarone prior to the elective cardioversion. So these are the specific uses which are asked in the examinations. Now, adverse effect. Amiodarone can cause hypo as well as hyperthyroidism. It will cause corneal deposit, lung fibrosis and pneumonitis, lung fibrosis in the lower zones, liver fibrosis, and it causes hepatocellular toxicity. Now, hepatocellular picture, you will have alanine transaminase 2 times the upper limit. So this will cause a hepatocellular toxicity. Peripheral neuropathy. Hepatocellular toxicity. Peripheral neuropathy, this is a demyelinating type of peripheral neuropathy and myopathy. It also causes photosensitivity. So you will have a history of rash on face or arms after the patient has been treated for arrhythmia in the past. So that will be mentioned in the question. Then it will give a slate grey appearance to the person. Apart from this, it will also cause bradycardia. So on the heart, the adverse effect are bradycardia, prolonged QT interval. So that's all for amiodarone.